To test hip abduction, the glute med, in men specifically, we have the patient inside lying. The bottom leg is flexed for some support. We keep the hip in neutral, internal, and external rotation, and we watch to see that it remains neutral throughout the test. We also watch the trunk to make sure it doesn't move backwards or forwards during the test. We ask the patient to abduct fully. If they can move through the range against gravity, they're at least a 3. We first apply resistance at the ankle and ask for a hold. If he can hold there with maximal resistance, that's a 5. If he can hold with pressure at the distal femur, he's a 4. An alternate grade for a 4 is moderate resistance with resistance at the ankle. The test for TFL is similar, except we have the hip flexed to 45 degrees and ask the patient to abduct, and we apply resistance the same way we did for the gluteus medius. For a grade 2, we have the patient supine, and we support the weight of the leg and ask the patient to abduct or bring their leg outwards. If they can move through this gravity minimized range, they're at least a grade 2. We can also palpate the glute med for a grade 1. For TFL, grades 2 and 1, we ask the patient to come up into a long sitting position because this places the hips around 45 degrees of flexion, and we can again support, take away the friction between the plinth and the leg, ask for them to lift their leg out, or we can palpate the TFL, which is just in front of the glute med at the side of the hip for a 1.